their decision-making, help funders understand what is happening on the ground and in the communities, to connect and encourage funders to communicate often with one another, including sharing information, news of what you're doing, working with a number of partners to advocate for policies that move the funders forward, and nonprofits work to address the coronavirus crisis. Excuse me, folks, I've been doing a lot of talking today. To that end, we have developed a one-stop web area on the CNJG website for funders. The page includes links to webinars, member actions, government resources, resources from philanthropy serving organizations, articles of interest, and other resources. We are also constantly curating information and adding to this page. So please check it and check it often. We have also created a COVID-19 funders listserv for grant makers, so you can share information quickly. I encourage all of you to use this listserv to share news, ask questions, and more. If you are not a subscriber, please let us know and we'll add you to the list as soon as possible. I want to give you a quick overview of the agenda for this call. We'll begin by hearing from Keith Adams, the Executive Director of New Jersey's Volunteer Organization for Action in Disaster, known as VOAD, followed by an overview of the philanthropy's commitment to during COVID-19, which is a pledge I want to take a few minutes to discuss. And then finally, we'll have a small discussion on a map that New Jersey funders can use for the response efforts. So now please join me in welcoming Keith Adams, Executive Director of New Jersey VOAD. Keith has been with New Jersey VOAD for a number of years, and before even being there, he has always been involved in response work. New Jersey VOAD organization active in disasters is on the front lines of all of our disasters. We will also allow for a series of questions after he finishes his presentation, and you could place your questions on the chat box, which Anna DeLea will be responding to and adding your questions as they arise. So Keith, could you just give us a little overview about the work that you did, that your organization did during Superstorm Sandy, about learning about long-term and philanthropic engagement during those times?
Sure, Maria, I actually included that in my presentation, and I'll talk about that during it. But I do want to point out that, so as Maria said, I'm Keith Adams. I'm currently serving as the Executive Director of New Jersey VOAD, and that's Voluntary Organizations Active in Disaster. And we're not exactly a household word. So if you're wondering who we are, so I will just say this, and that is that you might not recognize our name, but you certainly know our member organizations, such as the American Red Cross and others. Catholic Charities, United Way, Islamic Relief, Nakama. Bear with me just a second. I'm trying to get this presentation up so you all can see it instead of my face, and hopefully you'll be seeing it shortly.
It's up.
It's up, very good. So Salvation Army, Presbyterian Disaster Assistance, United Methodist Committee on Relief, AmeriCares, Suzy Foundation, Mennonite Disaster Services, United Six, St. Vincent de Paul, and many other faith-based and nonprofits that respond to disasters both small and large. So we're a coalition of organizations that contribute to developing and sustaining community resiliency throughout the disaster cycle. At our foundation is relationships, building partnerships to improve outcomes for people and communities affected by disasters, by facilitating cooperation, communication, coordination, and collaboration, our 4Cs, among nonprofit organizations, community-based groups, government agencies, and for-profit companies. So we're the New Jersey affiliate of National VOAD, which is my privilege to serve as the vice chair of National VOAD as well, like I needed another hat. We're the recognized non-governmental leader of the disaster preparedness, response, and recovery sector. We're the only disaster network in New Jersey that links and harnesses both the power of voluntary organizations and government. Our VOAD members and partners represent a powerful force of goodwill in both our local communities and across New Jersey. Through our network, we provide the leadership that makes our community stronger and more resilient. In times of need, excuse me, I'm like Maria, I've been speaking a lot today. In times of need, this delivers hope for a more positive future. So what's our normal mission and focus and purpose? At New Jersey VOAD, we know, and we learned this specifically in Sandy, that disasters begin and they end in local communities. That's why we work tirelessly to connect local civic, neighborhood, faith-based businesses and service clubs and government officials across our state, their organizations, and also to our state and national organizations and partners. Our COAD, which is a little bit different than VOAD, it's Community Organizations Active in Disaster. We have a network of these COAD groups that has a presence in each one of our 21 counties and forms the basis of building community resilience for disasters large and small. In times of disaster, our network of statewide member organizations and state and federal agencies connect these community groups to essential services and resources, both state and nationwide. So again, getting back to this idea that communities recover as communities, it's a matter of linking those local networks or those horizontal networks to the vertical networks that are available through national or state and national partners and state and national government. So Maria, here's the answer to your question. In Superstorm Sandy, over the 6 and some odd years that we were, well, actually almost 7, very active in recovery efforts, we learned the importance of this close coordination, communication, collaboration, and cooperation to maximize positive impacts to individuals, households, and communities. New Jersey VOAD and our members assisted over 30,000 households to recover from Superstorm Sandy. We rebuilt 4,000 homes and provided over $120 million in direct financial assistance to survivors. And along the way, we facilitated the work of over 450,000 volunteers, providing a cost savings of over $100 million. So we know firsthand that well-connected communities recover stronger and faster from that experience. So what does New Jersey VOAD do when disasters or widespread emergencies, like our current COVID crisis, what do we do in those cases? Well, we provide, first of all, communication with and coordination of our national VOAD member organizations, our New Jersey VOAD member organizations, and county and regional COADs. So we provide platforms for collaboration and cooperation to support their missions of effectively serving survivors' needs, and especially with a view to those who are most vulnerable. Throughout the disaster or emergency, we host coordination calls, collect situation reports, and hold teleconferences to share resources, needs, and situational awareness. We connect the efforts of the voluntary, nonprofit, and faith-based organizations to the New Jersey state government. We're assigned to the New Jersey State Emergency Operations Center, where we plan and coordinate emergency response and recovery, and we're recognized in the New Jersey Emergency Operations Plan. We work closely with our state government departments and agencies before, during, and after disasters. We partner also with our federal agencies such as FEMA, HUD, Health and Human Services, and Small Business Administration. We maintain the Help NJ Now website, which is created in partnership with the New Jersey Office of Emergency Management and the New Jersey Governor's Office on Volunteerism. This is a one-stop information hub for disasters that link the public with vetted preparedness, response, and recovery resources, as well as acts as a web-based donation and volunteer management portal. So it has two different modes to it. One we call the blue sky mode, and actually it is still, even though we're in the midst of a disaster right now, we have left it in the blue sky mode. We've done that intentionally to best at this point respond to the kind of nuances that we're called to in COVID-19. Had this been a Sandy or similar natural disaster, we would go and immediately open our volunteer register and our donations registry on what we call our gray sky page. But instead, this time we've tried to provide that public-facing information on the blue sky phase, because we're not quite ready to open the in-kind donations portal or the volunteer portal. And again, I'll talk about this a little later in the presentation, but we're trying to be very nuanced. We've issued some new guidelines for volunteering during this time of COVID, because it's just not a Sandy. It's not where we are mobilizing hundreds of volunteers and having them come to one place and then deploy them out. Obviously, that would not support our current shelter in place or social distancing guidelines that we have. So a little different this time, but we are adapting as we go along. We plan, coordinate, and staff response and recovery activities, and they may be things like points of distribution. So for instance, last June when there was flooding in Burlington, Camden, and Gloucester counties, we had points of distribution for flood kits and personal hygiene kits where folks could come, hopefully someplace close to their neighborhood, and receive supplies to clean out their house that had been flooded and support their basic needs. We also did, during that particular disaster, what we call a MARC, which is a multi-agency resource center. We did 2 of them in Burlington County and 1 combined for Gloucester and Camden. And these are kind of one-stop shops, if you will, where folks can come in, and they are staffed by all our member organizations, government agencies. So anyone who has a resource that can provide survivors of a disaster, that's where we start. And then ultimately, if necessary, if we're going to go into what we call long-term recovery, and the last time we did that in New Jersey was Sandy, and I think many of you are familiar that we had long-term recovery groups, and we helped to coordinate, establish and set up and coordinate the work of the long-term recovery groups that may emerge. New Jersey VOAD is a nonprofit corporation. We're a registered 501c3 charitable organization. So we have the ability to receive and distribute grant funding, both directly or from funders. We have a Platinum Guide Star rating. We're governed by a board of trustees, and then our daily activities are accomplished by our staff under the direction, although sometimes I think they direct me, of a full-time executive director, who is me. Our business on purpose, our business and financial management systems and fiscal controls have been specifically designed to be able to expand in response to disaster needs. So during the apex of Sandy, we had a total of about 8 folks employed. Today, we're still in blue sky mode because we haven't expanded yet our staff footprint for COVID, but we're down to only 2 full-time employees right now. So as you can see, our systems have to be able to move from basically running a very small nonprofit up to a larger operation, and that's what we have planned for. So that brings us kind of to the question of what we're doing in response to the current pandemic. So I will tell you that our organizations have been working for the last, actually some of us for the last 2 months, to assure that we're prepared to continue to provide services to meet our community's needs. These services include shelter, medication, transportation, and mental health needs, for instance. Our plans have also focused on how we can increase these services should the need rise. We're also kind of focused, as this is going to be a long-term event, that we know that flooding incidents, and we're a little more than 40 days out from our hurricane season. So we're certainly looking to design capacity to take on natural disasters, which is kind of our normal book, as we say in New Jersey, but to be able to do that well on top of the current crisis. We've been in close communication and coordination with our state and federal government partners to ensure unity of effort. We're monitoring situational updates and responding to requests as part of the New Jersey State Emergency Operations Center. We do this both in person as necessary, and we also monitor our requests remotely through a system that we have to respond to those requests that are coming up from not only our organizations on our side, but those that are coming up from our county and local emergency management directors coming into the state EOC. Also supporting state agencies as they have requests. For instance, the Department of Health is currently asking for medical volunteers to register. We've been working with them for the past week on making sure that registry is up and ready to go. And of course, if you know anybody in the healthcare field who wants to volunteer to support our health facilities or help staff those facilities that are going to be opened for the overflow of patients that we expect, you can go to the New Jersey COVID Information Hub, and there is a space there for you to do that. We've also been working with local food banks to try to make sure that they have volunteers and other human service needs that we've been trying to meet. So it's a gamut. We've, again, had to be a little nuanced in how we assign volunteers. We have a kind of new guideline that we work through that says is that, one, we have to make sure that the mission is essential, that volunteers are needed. We have to know what personal protective equipment they may need, or what kind of training, or what's the skill set that's required. And then the last piece that we're adding to this, and that is that we're trying to match up affiliated volunteers from our agency to assist other agencies in the local area. So we're making an attempt here not to be sending people, say, from Cape May to Bergen County or vice versa, to try again to reduce the unnecessary traffic and travel across the state in support of public health. As I talked before, we've updated Help NJ Now with some specific public-facing information from trusted sources, and are amplifying the messaging of our partners at the New Jersey Department of Health, CDC, World Health Organization, and the Governor's Office across all of our platforms. So we've implemented our continuity of operations plan, and I hope that many of you as organizations, I hope you have a continuity of operations plan, but that's the what if plan. What if COVID makes us all work from home? What's that look like, and who's in charge of what? If our number one manager turns out to be sick and can no longer participate, who picks up he or she's operations and such? So we have that plan because we're always looking for that, and we also have a set of disaster protocols, which is kind of our playbook for how we deal with disasters and widespread emergencies, and we're fully operational and staffing up for that. We're working closely with our members and partners to assess and respond to needs, and especially in this one, support kind of out-of-the-box solutions that support the health of our public and our volunteers. What we're seeing is working with, for instance, food pantries who used to let clients come in and actually shop from their pantry. That's obviously not a good idea right now with social distancing. So we've worked with them to show them how they can set up a point of distribution out in front of their place, or they could organize a drive-through, or they could do other methods which would allow them to safely still feed their clients. So that's an example of that. So we're also, as I mentioned, with the COOP, we offer COOP training. Again, that's continuity of operations planning training all the time. That's one of our kind of blue sky activities. We offer that to nonprofits, and we've also offered it to other organizations. We don't have the bandwidth to do a lot of that training, as you can imagine right now. but we do have posted on our website. There are resources for our members, and one of them is a free COOP template. So it's kind of like a do-it-yourself. So that is available to folks. We put that out there as a resource. On our page, we collect situation reports from our member agencies. We download them every day, and they actually are shared amongst all of our folks. So everybody has a good situational awareness, and we're providing some opportunity for them to collaborate on their work. But we also share it every day with New Jersey 211 Partnership. And they are kind of the landing page on a regular day for social service, to access social services in New Jersey. But they've really expanded their role. So they're also the #1 spot to get information and to ask for help for COVID, for the non-health portion. So we transmit that resource list that we get off of our situation reports every day to them, so they can update the services that are available to the clients which may reach out. So the COVID-19 disaster is obviously very unique. Then it is primarily a public health emergency. So unlike our experiences with Sandy and other natural disasters, the current crisis requires us to respond in a very different way, especially in light of, again, the shelter in place and social distancing requirements. So we must be extremely discerning in how we carry our missions, both for the safety of our clients and our volunteers. So like all disasters, it will require the combined efforts of the whole community to respond and to recover. Like all disasters, it will have cascading effects on our public, private, and economic lives. So as we focus on limiting the spread of the virus, the effects of protecting public health are creating economic and societal impacts that will last long after the health crisis is over. So a word on that: this will not be over by Easter, nor probably this year. Will we be sheltering in place? Will we still be social distancing? Will businesses and offices reopen soon? Maybe, but we're not in control. The virus is. And public health officials warn that we will continue to be susceptible to the virus until a vaccination is developed, or we develop herd immunity, or a definitive treatment is found. So although in my mouth to God's ears, a breakthrough could occur at any time, the CDC and other trusted sources predict a year to 18 months of some type of restrictions or some type of response to this. And certainly in New Jersey, we are planning at least at the year level in terms of state government and the nonprofit community. So what we're seeing now in terms of need will increase over time as this goes forward. These effects, as in all disaster, of course, fall most disproportionately on the most vulnerable. So we use this all the time, and you'll see on your screen is this thing that says every day is a disaster for someone in New Jersey. I'm often called to present around the country. When I put this up, it's usually a pretty good laugh line for folks that don't live in New Jersey. But what I mean by that is that our folks are responding to human need in New Jersey every day. So what am I talking about like that? Well, and you know these figures for the most part, but we have 10% of our population is poor. Almost 14% of them are children. We, on our last homeless day count, the number was a little over 9,300. And I think that that's a pretty low estimate, but it's all we have. We have 1 million of our folks are hungry, meaning they're food insecure. 1/3 of them are children. We have nearly 1 million of our folks that grapple with serious mental illness daily. And then we have the most common disaster in New Jersey, and that is house fires. And we have about 30 of them a day on average in New Jersey. And we're still, despite the fact, that COVID's going on, it's still, we're still experiencing fires. And our member agencies, such as the Red Cross, are responding to them to help households that experience that particular disaster. So the takeaway that I have from that is that this is the context. This is the paradigm, that the baseline, if you will, before you add on the effects of the current crisis. So for the most part, our members and agencies were working towards these kind of problems and helping people in these needs, and just barely getting by. So now COVID is creating a situation where we're increasing these numbers. So those who maybe were barely holding on without assistance before COVID, because their economic prospects have changed, or they can't have work, or their kids are home, so it's a whole different childcare piece, or maybe they're not getting their free school lunches. This is obviously changing things, and those numbers are increasing daily, and the need for help and demand on our agencies is as well. So when planning the allocation of funds, which I know this is a topic that you're all interested in, to me, it's important that we remember that this is going to be a marathon, not a sprint. And I know for several of you who are involved in Sandy, you've heard this before. We say it in every disaster, and that is that the needs will be spread over time, that the situational outlook is and will change. Well, so far it's changing about every hour, but it's going to continue to change, and it's going to change often as we go through this. So one of the things that I'd like you to think about when you're thinking about kind of timelines is to look, first of all, at the top of the slide. You'll see what we call the disaster cycle. So typically we talk about preparedness, and that's what we do in blue sky times when we're trying to educate people and have them plan and prepare. Obviously, the incident here has occurred, so we are strongly in the response area right here. And so in response, we take care of immediate needs. So the immediate needs around COVID right now, the non-medical needs, are about distribution of food, medicine, homeless sheltering, mental health, and addiction services. Of course, as I mentioned, the healthcare staffing, providing personal protective equipment for folks, temporary staffing to replace volunteers, nonprofit capacity building and sustainability, planning. This is one that has emerged in the last couple of weeks, and that is funeral expenses for the indigent. Finding out that we didn't have really solid plans about that. Wraparound programs and support services for seniors and the disabled and access and functional needs community. And then another emerging need is childcare for essential staff. And what we mean by that is that our local first responders and healthcare workers who are required to go to work, and now their kids are home and they don't have adequate childcare. And of course, as you probably know, most of our childcare sites in the state, if they're not specifically addressing the needs for essential workers, have been ordered to shut down. So that is a continue. So those are some examples of what I put in the first bucket, or the response bucket, or this is the immediate need. These are things that need to be supported now and over the next couple months as we're firmly in this response phase, which I think is pretty much defined by as long as we have not beat the curve, so to speak, and we're still shelter in place, that's where we are. So then I think as we move into the recovery phase, or the second bucket, and I'm looking at a timeline of maybe the next 3 to 6 months. So we're seeing a relaxation perhaps of social distancing and some of these closures. We are going to need ongoing food supply support for our feeding programs. We're probably looking then at some assistance to individuals, because we know that the government support will not be enough, around housing, utilities, transportation needs, and other expenses that folks occurred. So I know that you've probably seen the reports that say most Americans can't survive a $400 immediate expense. So for many Americans, if you're out of work and you're not receiving your normal paycheck, even with mortgage forgiveness and unemployment and everything else, we are going to see more folks that are going to try to access our programs for assistance. So we kind of see that as recovery needs. So what's this going to look at like? What's the societal and economic fallout from this particular crisis? And that's anywhere, you know, I think 3 to 6 months. But I think that recovery, depending upon when we see things return back to normal, that it might not be until the 18-month period. One of the things that, again, that we've talked about in the public health sector is that we may beat the curve. We may see some relaxation sometime over the summer months. But if we have not developed either a vaccine or herd immunity or some kind of miracle treatment, that we could be right back into social distancing and sheltering in place in the fall. So I think, you know, again, it's an evolving situation, but the takeaway is that this is going to be a long time before things are quote unquote normal. And then the last bucket, so we call that in the cycle, we call it mitigation. But those are kind of those longer term needs. So kind of the ongoing and continued support of providers. It may take people a long time to, and I'm speaking of individuals and households, to recover from this. So they may need support long term. It might not be the same support that they were getting in response or recovery, but we still anticipate needs. And then the other piece of that kind of mitigation phase, and that is how do we build in sustainable change? In other words, learning the lessons from this particular response so we're better prepared for the next crisis. So as you consider supporting nonprofits that are working on the front lines, I would ask that you especially consider the increased staff and expense that the organizations will incur, not only programmatically, but you need to make sure that you're supporting administrative as well as programmatic expenses. So I've kind of boiled it down to this, and I do mean this a little tongue in cheek, but if you want to ride the horse, you need to feed the horse. So I'm asking that you be flexible and agile. The situation on the ground is going to change frequently. So in the process of folks saying, look, we want to run this program, they may come to you even during the application process or shortly after receiving a grant and say, you know what, the situation on the ground has totally changed. So could we try to do this? So two things. One is that you're supporting administrative expenses to support the employees and systems that our nonprofits need to actually put those donor dollars out on the street in an effective way. Because most of them were just not set up under our normal mission to do that. So, and the other is to be very flexible again, because things are going to change frequently. I would ask that you consider a just and equitable distribution of resources with a focus on individuals in need rather than looking at geographic or political boundaries. So I've worked with the philanthropic community for a long time. I understand that some of you are constrained by the way your funds are set up to certain geographic areas or other populations, perhaps, or ethnicities. We all have our constraints, but I would ask that you would work together as grant makers to try to make sure that you are providing a just and equitable response so that all the communities in New Jersey, all individuals in New Jersey that need our help are going to be able to get it in a meaningful way. We saw in Sandy where money got out very quickly, honestly, before we had the systems to effectively distribute it. A lot of times we saw money that went out early on, specific to geographic areas, which caused a disproportionate, and I'll just put it out there. So in Bergen County, as part of the long-term recovery group's efforts out there, there were people who could even get automobiles replaced that were damaged in Sandy, whereas in Cumberland County, it was hard to get a few dollars to put roofing on someone's house who was similarly situated or affected by Sandy. So we want to prevent that from happening. The other reason that we want to prevent these kind of things from happening is that, and I stole this from one of my colleagues that I was on a call the other day, and she said, we need to avoid the nonprofit Hunger Games. And that's something that we certainly saw in Sandy, where our long-term recovery groups actually became competitors against each other as they tried to get support from the various funds. That's not the best way that we can do things in New Jersey. I think that when we all kind of are working together and making sure everybody's getting what they need, we don't need to have this devolve into a competition. So I'd ask that you foster systems that reward collaboration amongst nonprofits, and try, please, to resist creating the nonprofit Hunger Games. So consider where possible, if you could, also in this, along the same lines, is using a common grant intake and reporting process. I know that's not possible for all of you, but I do know that New Jersey grant makers had undertook that effort to come up with a common grant intake. Perhaps that needs to be tweaked or revisited, but this actually reduces overhead costs for both you as a grantor and those of us in the nonprofit community as grantees, which ultimately results in more donor dollars going directly to those in need as opposed to administrative expenses. I'd ask you too to consider that, as you've heard in the news the last week or so here, that we will be receiving multiple streams of federal funding. That federal funding comes to the state and it's block granted to the state, but it comes with some rules and some strings, as we learned in our work in Sandy and other disasters. So some of these funds are actually subject to what they call the duplication of benefits rule. So what that means in a nutshell is that benefits received from the nonprofit and philanthropic community to individuals and households can actually reduce the government benefits that they're eligible for. And that in essence means that our donor dollars are replacing government funds that otherwise would be available. I think that that's, we certainly don't want to do that. We want to be the last dollar in. We want to be able to be making up the difference in people's recoveries after these government programs are applied. So that would be the other thing that I would ask. There is some resource out there for the philanthropic community. I hope that you're all familiar with the Center for Disaster Philanthropy. They are national VOAD members. So I'll promote that a little bit, but they have this thing called the Disaster Philanthropy Playbook. And the website is up there on the screen in front of you. This kind of allows you, it's a kind of guided walkthrough. It's broken down into several different kind of paths that you can take, whether you're primarily interested in supporting, say, community organizations, disaster organizations, arts and culture, legal and advocacy issues. But you can explore that and you can learn lessons that folks have developed in responding to disasters across the country and use that as a resource. So, and lastly, here is my contact information. I know Anna and Maria have that and they can share that out, but I put that up there, my email address, and also our two websites. One is our organizational website, and then of course the Help NJ Now. So I think that's pretty much what I wanted to cover and give you information on. And I don't know if we have any questions or not, Anna, because I haven't been checking the box.
Thanks, Keith. I just want to thank you for that presentation. Very informative, very helpful to us. And I will be saying something in a little while that segues to some of the recommendations you made to our group. But before we do that, before I jump to that, why don't we go ahead and Anna, we have some questions, or Craig?
I do not see any questions in the chat, but if
means I did a good job.
Yes, but if people do have, we have time for a couple questions if anyone has anything that they would like to ask.
And if you are on the phone, then you need to press *6 to unmute your line.
Oh, I have one. Okay, here we go. Oh,
Hi there, this is
oh,
Bernadette Muller. Can you hear me?
I can.
Okay, hi Keith. I'm with Valley Bank. Thank you for your presentation today. Unfortunately, I couldn't view it, but I certainly listened to it. I look forward to receiving, hopefully, a copy of it. But I do have a question regarding your focusing in, obviously, on need. Can you provide a little bit of insight and color into how to assess the need from the various levels of the food chain, for instance, since that's a very big one right now, from the food banks to the food pantries, and then even into the shelters? Do you provide any guidance in terms of sustainability, or obviously this is something outside of our normal assessment?
Right. So, so in terms of how that relationship works, for instance, we're connected with Community Food Bank of New Jersey, which is Hillside in Egg Harbor Township, I believe, and also the Community Food Bank of South Jersey, which is in Pennsauken. And then, forgive me, I don't know their new name because I do know it, but it escapes me at the moment. But what was formerly the Monmouth and Ocean Food Bank. So they are state VOAD members, so they are a part of our situational reporting and our coordination calls. So one way we assess needs is we're in conversation with them. And specifically, we talk to them about things around food supply and around volunteer availability. In other words, are they able to actually do what they do? And are they able to step it up? And what do they see the needs in their location? So that's one level of communication. We also, because we sit at the State Emergency Operations Center, we have a group that is called, and this is kind of, emergency management speak, but we call it ESF6. So ESF6 stands for Emergency Support Functions 6. And the purpose of that particular desk in the SEOC is to coordinate what we call mass care and feeding. So our food banks are already hooked up into our mass care and feeding plan. And it also involves organizations like the Salvation Army, who is doing a lot of feeding. And then we have some others even as creative as an organization called Operation Barbecue Relief. And they're definitely people that you want to come to your town for the obvious reasons. So we're gathering information from those folks. And then on the other hand is that we also, because we have our faith-based folks and nonprofits throughout the state who are actually in the community, so the recipients of the food bank's goods, if you will. So we're talking about our feeding programs and our food pantries. We're also in contact with them. So it's basically creating kind of this web, if you will, of information sharing between the food banks, the local community organizations that are doing the distribution in their network, and then back to our state partners. The other level that we have, our food banks in New Jersey are a part of a network across the country called Feeding America. And Feeding America is also a national VOAD member. So that becomes another level of coordination where we can actually coordinate with the folks in food banks across the country. Now, to the sheltering piece, this is not kind of a mass sheltering situation right now with COVID. Obviously, we're trying to get people home. So the focus of sheltering has been on homeless population. And we're actually working right now with our DHS partners and others in our community to develop what we call non-congregate sheltering. So normally we open up a shelter, like in a case of a natural disaster, go to the school gym, go to the Prudential Center where we set up beds and so on and so forth. We call that mass congregate sheltering. Obviously, we don't want to do that right now when we're talking about social distancing. So we're actually looking at places like hotels that can serve as the non-congregate shelter, and also state facilities like empty buildings in our developmental centers and other places. So I hope I answered the question. It was kind of it was a wide net, I know.
No, it was informative. Thank you.
And then we have a quick question about your membership, and if only members of NJ VOAD get the funding for these efforts.
Mm-hmm. So again, I would point out to you that there is members of New Jersey VOAD, which are member agencies. So I'm talking about, for instance, Catholic Charities at the diocesan level. So Catholic Charities, for instance, the Diocese of Camden, the Diocese of Trenton, and the other two dioceses are statewide members. But, they become kind of the ability of us because they're connected with their local congregations. That's our level of connection down to them and down to the local community and what they're doing in those particular centers. It's the same with the rest of the major faith-based organizations. The other level of connection we have, as I talked about on the call, is our network of community organizations active in disaster. So this is kind of where the local Baptist church or the community organization, oftentimes like the Rotary or Lions or whatever, can plug in along with the local emergency manager, or the municipal officials and county officials can plug in a much more localized way. I'm not sure if that answered the question, but kind of how that network works.
Thank you. And then we do need to move on shortly, but I do have one question, if we could put in one last question. Can you discuss what coordination needs are needed locally to help bridge communication, coordinate efforts, highlight resources, manage volunteers? And can you speak about what is NJ VOAD's support and what is the local VOAD's role?
Sure. So the New Jersey VOAD, our kind of local, or our primary purpose, to provide that platform of collaboration again between our government agencies at the state level, who are pulling a lot of the triggers on this stuff, our statewide partners, and then hopefully through our co-ad organizations right down to the local community. So kind of two levels of communication. One is through the State Emergency Operations Center, where we're gathering information from local emergency managers into our system. And then we're also getting the word on the street, as I say, from our programs that are actually on the front lines doing work. The coordination piece, I often tell people that I'm a cat herder, that herding cats is not easy, but it can be done. So what are the kind of tools that we use? It's our website situational reports, where they file daily to update us on what their needs and the three main questions. And that is, what resources do you have, or what are you doing and where are you working? And then what is it that you have in terms of resource that you could offer? And then the fourth thing is that what are your needs, so that we can connect them up with resources. So that's kind of how it works. It's a two-way back and forth conversation. We have a weekly coordination call that we have all the, it takes about an hour and a half, but we have everyone report out. And then as we have emerging needs, we either find out about those emerging needs because our local partners have called us directly to match up those needs, or we're getting it through the emergency managers through the State Emergency Operations Center. So it's multiple lines of communication and trying to kind of knit them together in a coordinated way. And that's what we did in Sandy. Like I said, we had our 14 long-term recovery groups, but we also worked with groups that were just meeting every day about donations, others that were focused on efforts, and so on and so forth. So
that's wonderful. And Keith, I hate to be a taskmaster here, but we do need to cover a few other areas. And again, the information you shared with us was extremely informative. And I do want to say that Teresa Jacks is going to be joining the NJ VOAD Monday morning
actually,
coordinating calls. because coordination in this situation is going to be absolutely critical. I think the most important takeaways from your conversation today is not only the work that you do, but the fact that coordination is key to effective distribution of resources. And so you mentioned something that I want to emphasize with everyone here is that as grant makers, we have to be very vigilant not to pour our resources out into the community so quickly that it may deplete the impact that we're going to be able to see from the federal and state funding that's going to be coming through. So I think we need to pay particular attention to that in this situation, because the resources or the relief funds that are going to be coming down the pike are unprecedented in our experience. So we need to look at that carefully. So that was important. The other thing I want to bring up is that this segues into, the other piece that you said that was very critical is that we have to make sure that there's real equity in the way distributions are made so as not to leave anyone behind in this process. So there's, which segues me into two things that we want to make sure to cover with you before we leave today. One is that if all of our members go to our website, we are really encouraging all of our grant makers to sign on to the Council of Foundations call to action, which is asking philanthropy to make a commitment during this time of COVID-19. And rather than go into each one of the areas that they talk about, Keith, you actually, within your presentation, when you talked about where foundation grant makers, how we need to distribute our dollars during a crisis and beyond a crisis, it really spells it out very well if you go into that site. So I would love everyone to go into our website, look at the call of action, and it would be wonderful if we could get 100% of our members to sign on to that particular call to action pledge. And we right now have about 4 or 5 foundations that are members. We'd love to see our whole 130 sign off on that pledge. So with that, I want to move it on to another piece that we're looking at in regards to equity or equitable distribution. And I'd like Craig to take a few minutes to talk about a project we're undertaking with Candid to look at how we're distributing dollars and mapping that in a way that we could track our impact and trying to see how we can make sure to cover all those communities that oftentimes are left behind. So Craig, let me turn it over to you.
Thanks, Maria. So on the couple of calls that we've had already responding to this crisis, several members have already asked CNJG to provide a database for COVID-19 funding coming from New Jersey's philanthropies, both local, statewide, and nationally. We agree that it is critical to be transparent and share this information with other funders to help inform your philanthropy in the coming weeks and months. So fortunately, Candid, which is the organization that was created from the merger of both Foundation Center and GuideStar, launched a new coronavirus map using the technology they already have in place, saving us, CNJG, a great deal of time, money, and effort. So by tomorrow, we're going to have a couple of new pages on our website that will detail how you can submit your grants data for your COVID-19 response and offer links to this map of coronavirus response funding. This map has the ability to track funding globally and even down to municipality level, provided that information is provided. So the map uses the same technology as our Get on the Map campaign that we have promoted frequently at meetings and through our website that we have continued to partner with Candid on. So you will see once those maps go live from our website, the information they've collected is not complete. They've only scraped news releases for most of that information. And this is where we need your help and where the New Jersey philanthropic sector can be leaders. So we are asking each of our members that are involved in COVID-19 specific funding to submit their grants data. We will be giving very detailed instructions on our website as to how to go about doing that. And if you have any questions on that, you can certainly contact me, email, or phone, and I can help walk that through with you. I'm not going to take the time to do that now, but we can. You'll all be able to see that information once we get those pages up on our website. The other thing that they are also tracking, Candid, that is tracking our information on funds established in response to the outbreaks. So we know that there are now 7 response funds in New Jersey. New Jersey Pandemic Relief Fund, United Way of Greater Newark, Princeton Area Community Foundation, Northern New Jersey Community Foundation of South Jersey, the United Way of Greater Philadelphia and Southern New Jersey, and now we also heard about United Way of Northern Jersey and their Alice Recovery Fund. Talks a lot about that equitable piece as well too. So if you know of any other response funds that are happening out there, please let us know. That will also be listed on Candid's site. So gave you a lot of information, but realize we will have that information up on our website probably by tomorrow. And if you have any questions on that, please feel free to contact me by email or phone.
Craig,
Thank you.
I'm thinking that perhaps with the Candid survey that we're talking about, the mapping, perhaps we can even do an e-blast for that to get people's attention, because it is going to be something that is going to need to be timely, and it requires an urgency.
That is one of the other things that we will end up doing. Yes, thank you.
Okay, wonderful. So that's the end of our program. If there's any questions that came up that we weren't able to address because we were running out of time, we will get those questions to Keith, and Anna will make sure to get them to folks that were interested in getting that information. At this point, we hope to keep in this continuum by hopefully in one of our next sessions, talk with and have presentations from the funds that are the regional funds that are setting up, so you can start seeing some of the activity that's taking place there, the work that's taking on the ground, so that all of us, not just the regions where those funds are happening, can collect that information. I also, after this, realized that one of the sessions we're going to need to have is more sessions with the state to listen specifically about how those dollars are going to be distributed, so that we can be more strategic about our grant making. So Teresa and Anna, that's one to put on the list from there. Thank you for participating in this first of a series of funder briefings. I just want to see if there's anything that I might have left out. Anna, do you think there's anything else that needs to be said before we close out?
No, but I will just mention that I want to point out in the chat, someone said that there was a New Jersey Community Capital Loan Relief Fund as well. So we'll look into that as well.
Oh, can I just say something quickly about that? That fund, I think, was started by the Victoria Foundation, because they mentioned it at a Newark piece. But we should, and it's just up and running, and I think it's very innovative. So we definitely need to cover that, because it really deals, I think, with a lot of the issues beyond when we talk about from response to recovery, it starts going in that direction as well. So thank you all for participating in today's session. Look forward to talking to you again in the weeks to come.
Thank you.
Thank you.
Thank you so much.